So in physical level, they have this tendency to involuntary movements, that these involuntary movements is expressing in twitching, in trembling, jerking, and irregular, uncertain, and exaggerated motions. Also, we see a kind of paresthesia. This paresthesia in fungi is like a neuralgia, like a cold needles run through the nerves. Or also other patients are telling that it's a kind of coldness and stiffness sensation of any parts of the body, but especially at the end of the limbs, so fingers, toes, hands, feet. And also they feel during this paresthesia sensation a swollen sensation, but this swelling is like as if frozen. So it's a kind of coldness and chilliness, icy cold, frozen, swelling. And also they are telling that during this paresthesia, they feel a kind of formication of the skin. On the top. So in homeopathy, in our patients, we see this bleeding that can appear as a kind of epistaxis. So now let's speak their sexuality, because it's really very important to see in homeopathy. So related to this paresthesia, and I told that this chilliness, this frozen sensation they can feel in some part of their body, but in general, they are very chilly patients. But what we are seeing in homeopathic field, that they have this tendency for new growth. And what does it mean, new growth? So we have seen ovarian cysts, we can see lymphoid, and what is their other common characteristics? Yesterday, but also last times, we told that we see the remedies through the evolution. So also as a kingdom, as a fungi kingdom, can have an evolution in their pathology. And especially in their first phase. So when they are more or less balanced, when they are more or less more confident about themselves, in the early state of their pathology, they fight for their rights. They fight for other things. They fight with other people. And the other topic that we see, it's a kind of expanding my knowledge, expanding my strength, expanding my influence. But let's see that how they are behaving when they are on the evoluted, so in their second phase of their pathology, when they are getting a little bit deeper in their pathology, when they are really imbalanced within themselves. So in this phase, we see a kind of awkwardness. So in this stage, this awkwardness means that they are exaggerating the movement. So they can have this delusion that, for example, the arm or the limb is bigger or longer than they are thinking. And that's why they are put together all this knowledge, all this explanation into 8 essentials of fungi. So we see a solitary life, a lack of communication and emotional distance, but now we understood that this happens in their second phase of their life. This sentence that I don't like to belong to the mass, I'm special and different from the others, so you understand that this is a kind of superpower quality. So this is the first stage of the evolution.
Okay, so this is a case of a boy. When I saw him the first time, he was 6 years old. He's still my patient. I'm following him so now since 8 years and a half. So about the history, the delivery was normal, but after birth, he found it difficult to suck the mother milk, and the mom felt him hypotonic. So immediately they understood, I mean, in the first months of life, they understood that something was wrong. So then he started to have abscences and epileptic fits, and related to abscences, in the span of 12 hours, it could have also 20 episodes of abscences. So the first tooth, this is about the evolution. The first tooth, when he was 10 months, and he had some problems like diarrhea and salivation. He started to walk without support when he was 15 months, but what was peculiar, that he started to walk, but he started to run. And when he was walking and he was running, often he was falling down. Then after 2 months, the parents told that he began to have more understandable speech. In the kindergarten, they say that his displays of affection are now calmer than before, because he was embracing everyone, touching everyone, and thus more willing to play with others. And the psychomotor says that is more eye contact, that at the beginning was not there at all. And this can be a good use of my book about children. In this remedy, we have some rubrics related to slow development. And in fact, we have mind development of children arrested, slow learning to talk, and in general, the arrested development, the slow development of bones, and the late learning to walk, and also the difficult dentition. Then this remedy has some symptoms related to aggressiveness on the non-verbal level. So we have the remedy in the rubric biting himself, destructiveness, tearing things in general, throwing things around, and throwing things at person. So let's see the repertorization, and you see from the repertorization very clearly we have a remedy that is coming out as a first remedy. So when you have to, when you are thinking to this remedy, there is one topic that has to stay in, that for these patients, anger is not allowed. And in fact, you see a kind of destructiveness from suppressed anger and suppressed emotions. So they cannot become angry. Anger for them is not allowed, so they are suppressing a lot the anger. So you have to think to remedies like Staphysagria or Columba palumbus, these remedies that are really suppressing a lot their anger. They are always ready for care, sacrifice, and support even if is dominated and exploited. So, because they have the tendency to be dominated. Also, if they are dominated, they are always ready to care, to support others, and to have to do sacrifice for others. They are reliable, loyal, and diplomatic persons with an excessive sense of duty and responsibility.